Hi, I'm Dr. Tom Mitchell, and today I'd like to talk with you about natural solutions for arthritis, how to prevent arthritis in the first place, and then how to manage the arthritis if you already have it without prescription medication or surgery. Good. So let's get started here. So the most common types of arthritis are osteoarthritis and rheumatoid arthritis. And today we'll be talking about osteoarthritis. Osteoarthritis is uh, the most common form of arthritis, and it affects, according to research, affects about one out of 10 Americans. I think it's much more prevalent than that. I think that many people have hidden arthritis that hasn't been diagnosed. And for people over the age of 50, I would suspect it probably affects about one out of three. So, um, symptoms of arthritis, I'm sure many of us are aware of this. It's pain, stiffness, loss of flexibility and swelling. This is a view of what osteoarthritis of the spine looks like. On the left, you see a normal spine with the disc spaces well preserved, and the vertebrae don't have any deformation. On the right, you see an osteoarthritic spine. You see the bone spurs that are happening, the loss of the disc space. Often you'll see a bulge or a disc herniation as well with osteoarthritis and a narrowing of the disc space. So often what happens is when it gets very advanced, the discs or the bone spurs can actually start pressing in on the nerve roots and cause symptoms like sciatica and numbness and tingling in the extremities, in the arms or legs. So here's what osteoarthritis of the hip looks like. It's usually worse on one side than the other. On the left, we see a normal hip joint with the cartilage well preserved. And then on the right, we see again the bone spurs and the loss of the joint space. And so this is the cause of the stiffness. And we'll be talking about some things that can be done actually to help to heal the cartilage and to reduce the pain and stop the arthritis from progressing. So here's an interesting fact that many of us are not aware of. The long-term use, according to a recent study, a long-term use of anti-inflammatories such as ibuprofen and naproxen can worsen arthritis inflammation. And so this is something that many people are taking these NSAIDs or non-steroidal anti-inflammatories long term, and it looks like from the research there's the possibility of actually making arthritis inflammation worse. So, and there's a lot of uh, negative side effects to the use of anti-inflammatories. Every year, nearly 20,000 people die from using ibuprofen and Tylenol, for example, naproxen. And in addition to that, 100,000 more are hospitalized. The main cause of this is due to gastrointestinal bleeding and perforation. And every time you take ibuprofen, for example, it causes about a tablespoon of bleeding in the digestive tract. And for people over the age of 60, the stomach lining has thinned quite a bit, and it's much more easily perforated. So there's definitely some risks to the standard medical intervention of using anti-inflammatories. So, we'll be talking about the Ayurvedic perspective on arthritis. Ayurveda is the ancient medical system of India. It's been around for at least 5,000 years. According to Ayurveda, we're not going to get too much into detail because it's a whole separate lecture, but according to Ayurveda, there are three doshas, Vata, Pitta, and Kapha. Vata is called the king of the doshas because it's the most powerful. It's the only one of the three doshas that is mobile, that can move, and it's the initiating factor in all the different processes in the body. It's made up of the air and space elements. And when the home of Vata is in the abdominal region, in the colon in particular. And when Vata increases, it's like pouring water into a cup. The water stays inside the cup until it reaches the top, and then it flows over and starts to flow. So Vata, when it overflows, when it increases due to Vata aggravating lifestyle and food, for example, then it likes to one of its favorite places to go is into the bones and the joints. And from the Ayurvedic standpoint, this is the cause of arthritis. So as we age over the age of 40 or 50, we get into the Vata stage of life, Vata increases, and then it likes to go into the bones and joints, as we said. So another factor in arthritis is inflammation, and from the Ayurvedic perspective, this is related to Pitta. Anytime there's inflammation, Pitta, which is the fire element, is involved. So the pain, the inflammation, anything ending with itis is a inflammatory process, and Pitta is always involved in that. So with treating arthritis, we want to not only bring Vata back into balance, but we want to bring Pitta as well back into balance. So how to prevent arthritis? This is again, excuse me, from the standpoint of Ayurveda, uh, and then so how to prevent arthritis, and then these are the same things that would help to prevent the progression of the arthritis. So first thing is inflammatory foods. According to Ayurvedic perspective and the perspective also of functional medicine, heavy, hard to digest foods have an inflammatory impact. So gluten is heavy, hard to digest. Dairy products are, and particularly cheese and yogurt, for example, are heavy and hard to digest. Red meat, any kind of junk food, and refined sugar. So then fermented foods are inflammatory. So vinegar, soy sauce, alcohol, pickled foods, yogurt, they will aggravate both Vata and Pitta. And sour foods will actually aggravate both Vata and Pitta as well. So extremely sour foods, so things like tomatoes and citrus fruit. And then there's the nightshade family of plants. So in both Eastern and Western herbology, it's understood that the nightshade family of plants contribute to joint pain and arthritis. So nightshades are, again, tomatoes, and then white potatoes. Sweet potatoes are fine. So white potatoes, eggplant, bell peppers, also chilies are members of the nightshade family as well. And they're extremely hot and spicy. It's called a pungent taste. And the pungent taste is the taste that is most aggravating both to Vata and to Pitta. So then eating excessive amounts of dry foods. Vata is dry in nature, and so eating like too much in the way of crackers, chips, and bread over time can aggravate Vata as well. And then eating raw food is difficult to digest, and so it's cold in nature. Vata is cold in nature, so it's going to aggravate Vata as well. And then following so avoiding these foods, or at least greatly reducing them, will help to prevent arthritis if it's in the process of forming, or it will help to prevent the progression of the arthritis. And a Vata reducing lifestyle. So Vata, you can help keep Vata in balance by having a regular schedule, eating at the same time every day, going to bed preferably early, and going to bed at the same time every day, getting up at the same time every day. These are the basic things that really help to keep Vata in balance. And to, again, we talked about prevent arthritis, prevent the progression of arthritis. So now we'll talk about some natural, over-the-counter, non-prescription uh, remedies or medicines for arthritis. The first is glucosamine sulfate. So there are actually quite a few studies on glucosamine sulfate. There are different forms of glucosamine. There's glucosamine HCl, and it's probably probably glucosamine sulfate is the most effective for helping to repair the joint tissue. So there are actually 20 double-blind studies showing a 72 to 95% improvement in osteoarthritis symptoms. Takes at least about 6 weeks to see the results, but it can be extremely effective for the stiffness. And glucosamine actually helps to repair the joint tissue, so it can result in some long-lasting relief. The recommended dosage is 750 milligrams twice a day. And like I said, it takes up to about 6 weeks to start seeing results. And glucosamine does not reverse the underlying degenerative process. but it repairs the joint tissue. When we looked at the spine and the hip joint, we saw that the loss of the joint space, and so because of the cartilage, so glucosamine helps to repair the cartilage and it helps to restore the lubrication of the joint as well. So it's a great medicine for arthritis. I'm sure we're all familiar with turmeric, but there are actually studies that showing that 3 studies showing that turmeric for arthritis is as effective as the anti-inflammatories like ibuprofen and naproxen. So it's strongly reduces inflammation. I actually prefer just taking full spectrum turmeric as opposed to the curcumin that you see because there are other uh, things in turmeric that have a very beneficial effect, and it's a whole lot less expensive just to take regular turmeric. And then, but it's better to take turmeric with a small amount of black pepper, which enhances the bioavailability of the turmeric. So, great. And then there's now we'll talk about a couple of different medicines that I really like to use in my practice because we talked about preventing arthritis and preventing the progression of arthritis. So Pain Mukti MJ is an Ayurvedic medicine that I have used for a long time. It's made by Ayushakti Ayurveda, which has a very modern manufacturing facility that meets all international standards, and they do extensive testing for any kind of contamination. It's very clean medicine. So Pain Mukti actually helps to remove the vata from the bones. It also helps to relieve the joint muscle and bone pain, can help to reduce swelling and inflammation, increase flexibility and mobility. We've got a study that's been done in India at a hospital showing that some significant relief of arthritis pain and joint pain over the course of a few months using this. And like I said, it really starts to attack the underlying cause of the problem. So, so the some of the ingredients, some of you may be familiar with these. Cyperus rotundus is something that has an anti-inflammatory effect, helps to reduce swelling, and then really one of the other ingredients I think you may recognize here is frankincense, which is boswellia, and that's a pretty well-known plant that's used for reducing inflammation. And then another remedy that is made by Ayushakti Ayurveda that again helps to resolve the underlying cause of the problem. It is Pain Mukti Sandical, and Sandical contains a bioavailable calcium that actually nourishes the bone tissue, helps to strengthen the bone tissue, and the nails and hair are related to the bones, so it actually will help you with nails and hair as well. It helps to again remove the vata from the bones and helps to relieve bone and joint pain. It's very nourishing for the bones and the joints. And then if there is a fracture, for example, can be used to help promote the healing of the fracture as well. So Sandhyog, the last Ayushakti medicine is called Sandhyog, and Sandhyog is anti-inflammatory, and I use it to reduce swelling. Often you'll see with arthritis, you've got some swelling, some fluid retention in the joint as well. And Sandhyog has some plants there that have a diuretic effect and really help to resolve the inflammation and resolve the swelling as well. So great. Ingredients here are Google, which you may have heard of. It's a relative of the Boswellia, and then some other things. But tribulus has a diuretic effect, and then Rosna is a anti-inflammatory as well. So, okay, so other natural medicines that I use in my practice. One is called Caprex. Caprex is made by Metagenics. It's been around for a long time. And the interesting thing about Caprex is that it has the same effect as the anti-inflammatories like Celebrex, ibuprofen, naproxen, but without the side effects. So it inhibits the inflammatory prostaglandins, which result in pain and reduction and inflammation reduction without the side effects. It can be taken long term, And the recommended dosage for osteoarthritis is 1 to 2 tablets twice a day. And yeah, I've seen it be really helpful for people. So there's a Chinese medicine I also use called channel flow, and it can be used. It's really mainly used for short-term relief for really severe pain, actually, used for relief of muscle and joint pain. And one of the main ingredient in channel flow is corydalis. Corydalis has no relationship to morphine at all. It's a completely different plant. But the amazing thing about corydalis is that it does give, and according to studies, gives 10% of the pain relief of morphine, which is significant. So without any side effects. So it has if it can be used longer than a month, but if it does, it needs to be combined with some tonifying or strengthening herbs. So summary, it's so from my standpoint, I've seen this in my practice. It's possible to prevent arthritis by addressing the inflammatory and vata-aggravating foods, following a vata-reducing lifestyle, and following the recommendations of an Ayurvedic practitioner. And if the arthritis is already present, it's possible to see significant improvements in pain and stiffness with the proper use, without the use of non-prescription, sorry, with the proper use of non-prescription medicines outlined in this presentation, and without the use of prescription medications or surgery. So one of the things that I have really focused a lot on over the last 25 years is learning Ayurvedic pulse diagnosis, which is called Nadi Pariksha. And I can actually tell from the pulse if arthritis is developing or if arthritis is already present. I can tell with very good accuracy where the arthritis is, if there is uh, osteoporosis that's happening as well. So this is something that can be used. I use in my practice to identify if arthritis is developing early stage or if it's already there. So it helps to from the prevention standpoint and the treatment standpoint. So uh, that's I hope this has been helpful, and I just want to encourage you that there are solutions to addressing arthritis, even if it's already there and without resorting to medicines that have the side effects of ibuprofen and other anti-inflammatories and without resorting to surgery. So thank you for joining me today. Hope this has been helpful. And if you would like to talk further, you can reach me at 919-785-2200. Again, it's 919-785-2200. Thank you. Have a great day.